An accurate impression is critical to ensure good appliance fit and minimal chairside adjustment. An appliance that fits the model it was made on but not the patient indicates that distortions may have occurred in the impression taking or model pouring procedures. Trays are made of metal, plastic, or styrofoam and are either disposable or can be sterilized. They may have perforations, mesh liners, or grooves to retain the impression material. A metal rim-lock tray offers retention as well as excellent adaptation. Perforated trays, although retentive, do not provide the same force of alginate adaptation around the dentition because the material flows through the vents before adaptation, minimizing detail of the teeth and tissue. If choosing a vented tray, select a style with smaller perforations. Once the tray style has been identified, the tray size that best fits the patient is selected. Once the impression tray has been selected, the next consideration is the type of impression material to be used. Alginate, which is an irreversible hydrocolloid, is the most common material used to make impressions. Some considerations in selecting an alginate material are accuracy, dimensional stability, setting time, taste, and compatibility with the gypsum or stone. For patients with a sensitive gag reflex, a fast-set alginate is advised, such as Kromopan. An irreversible hydrocolloid, Kromopan changes color during each stage of impression taking, requires minimal time in the patient's mouth, and remains dimensionally stable for 48 to 100 hours prior to pouring. Kromopan features a unique tricolor changing process indicating the correct time for spatulating, loading the tray, and placement of the tray. We are using Kromopan for this demonstration. We measure the powder first into the bowl and then add the water. Use a wet spatula for mixing. Mixing time is approximately 40 seconds by hand and the mixture will turn purple. When the mixture is pink, it is ready to load into the tray. If the tray does not have a rim lock edge or enough perforations, rope wax can be added around the edge of the tray. It will increase patient comfort and the wax will help hold the alginate to the tray edges. If using an alginator, follow the manufacturer's recommended instructions. Mixing time is approximately 1 minute. At this point, the mix should be a smooth and creamy consistency that does not fall from the spatula. Load the alginate mix into the tray. The Kromopan mixture will turn white when it is ready to insert into the patient's mouth. Insert the tray and press onto the dentition. The patient's lips must be pulled slightly outward to allow the impression tray to seat between the oral anatomy and the lips. Hold the impression in the mouth for approximately 2 minutes before removing it. For Kromopan, setting time in the patient's mouth is approximately 10 to 20 seconds. Hold the tray handle with one hand. With the other hand, gently loosen the tray along the top edge around the arch. When you feel the tray release, gently pull the tray straight down away from the teeth for an upper impression, or up from the teeth for a lower impression. Once removed, lightly rinse the impression with tap water and shake off excess moisture. Spray the impression with a disinfectant and drain. Do not allow the disinfectant to lay in the impression longer than the recommended kill time, as the solution can erode the alginate. Rinse and wrap in a wet paper towel until the work models are poured. For best results, the model should be poured within 30 minutes after the impression is obtained. If using Kromopan, disinfect, rinse, and shake off excess water. Place in a sealable plastic bag. Do not use wet paper towels or cotton rolls as the Kromopan impressions could distort and become brittle. Models can be poured up to 48 to 100 hours after the impression is obtained. Great Lakes does not recommend sending alginate impressions directly to the laboratory. If impressions are routinely sent directly to the lab, Kromopan impression material is recommended due to its long-lasting dimensional stability. If alginate impressions are used, lightly pack the void of the impression with damp but not soaked paper towels. Then wrap the entire impression with damp paper towels and place in a sealable plastic bag. Do not include the prescription paperwork in the same plastic bag. Prior to placing the sealed bag containing the wrapped impression in the shipping box, completely surround the bag with packing material to secure it during shipping. Fill all voids in the box. Make sure the impression cannot move during shipping. To prevent distortion or damage, the impression should not be exposed to extreme temperature conditions, either hot or cold. Here are some things to double check on your impressions. Alginate material rolled over the edge of the tray adds strength for retention. Proper depths showing all gingival tissue margins. Midlines are represented clearly in the impressions. Muscle definition is visible. Molars in distal segment are fully captured. Smooth anatomical contours. For more information, you can refer to our step-by-step impression taking guide, which is available on our website, or feel free to contact Great Lakes Customer Service.